Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on NuvaRing. So what is NuvaRing used for? It's used for preventing an unwanted pregnancy or contraception. So NuvaRing is most often prescribed for young women who don't have any major health issues. It's not suitable for women who have had an increased risk of getting a blood clot, including women over 35 who smoke. NuvaRing is more than 99% effective when used correctly. It's not affected by vomiting or diarrhea, but can be affected by some medicines. NuvaRing will not protect against sexually transmitted infections, so you need to use condoms for that. The most common side effects include vaginal discharge or infections, headache, feeling sick, breast tenderness and mood changes. Breakthrough bleeding, spotting and missed periods can be common in the first few months. So see your doctor if this persists. If you don't have a period for 2 consecutive months, do a pregnancy test before inserting the next month's ring. Blood clots are a rare but serious side effect of NuvaRing. So how does the NuvaRing work? NuvaRing contains 2 active ingredients, ethinylestradiol and etonogestrel. These are synthetic versions of the naturally occurring female sex hormones, estrogen and progesterone. The ring releases these hormones continuously into the vagina from where they are absorbed into the bloodstream. So the hormones in NuvaRing are similar to the hormones used in the contraceptive pills and work in the same way. They override your natural menstrual cycle and work mainly by stopping the ovaries from releasing an egg each month or ovulation. They also increase the thickness of the natural mucus at the neck of the womb, making it more difficult for sperm to cross into the womb, as well as thinning the womb lining or the endometrium, making it more difficult for any successfully fertilized egg to implant there. So you insert one ring and leave it in place for 3 weeks and then remove it and have a week break before inserting a new ring. During your ring-free week, the levels of hormones in your blood fall and you usually get a withdrawal bleed. That's like your period. So who shouldn't use NuvaRing? NuvaRing is not suitable for all women. So you shouldn't use NuvaRing if you're over 35 and smoke, or you stopped smoking less than a year ago. You're very overweight, so you have a BMI of more than 35. You've ever had a blood clot in your leg or lung. If you've ever had a heart attack, angina, stroke, or mini stroke, have very high blood pressure, or vascular disease. So can you use the NuvaRing if you're breastfeeding? NuvaRing is not the preferred method of contraception for women who are breastfeeding, because the estrogen in the NuvaRing can reduce the amount of breast milk you produce. If you do decide you want to use it, you shouldn't start until at least 6 weeks after the birth, when breastfeeding is fully established. So how do you use NuvaRing? So first, to insert NuvaRing, squeeze the ring between your thumb and forefinger and push it into your vagina until it feels comfortable. The exact position of the ring is not critical. Leave the NuvaRing in place for 3 weeks and check regularly that it's still there, particularly after having sex. After 3 weeks, remove the ring, then have a 1 week ring-free break. During this week, you'll usually get a withdrawal bleed that's similar to your normal period. Insert a new ring after 7 days, even if you haven't stopped bleeding. You'll still be protected in your ring-free week, provided the ring remained in place for 3 weeks. You insert the new ring on time and nothing else happened that could make the ring less effective, for example, taking certain other medicines. Don't flush NuvaRing or use NuvaRing down the toilet. Dispose of them in a bin, preferably in one one of the sealed sachets provided. So when do you start using it? Check with your doctor, because this depends on personal circumstances, such as if you're changing from another form of contraception, or if you're starting it after having a baby, or following a miscarriage or abortion. Your doctor will also advise on how soon you'll be protected against pregnancy. For some women, this will be as soon as they insert their first ring, but most women need to use condoms or not have sex until the ring has been in place for 7 days. Don't use female condoms, diaphragms or caps with NuvaRing. What if the ring accidentally comes out? So if the NuvaRing accidentally comes out, rinse it in cool or lukewarm water and put it back in as soon as possible. If you put the ring back within 3 hours, you will still be protected from pregnancy. If the ring is out for longer than 3 hours, or you don't know when it came out, then you may not be protected from pregnancy. If this happens in the first 2 weeks of ring use, you should reinsert the ring as soon as possible, and then either not have sex or use condoms for the next 7 days. What if you forget to insert the new ring after the 1 week break? If you forget to insert a new ring after your 1 week break, insert it as soon as you remember, and either don't have sex or use condoms for the next 7 days. If you had unprotected sex during your ring-free break and forgot to insert the ring on time after the break, then it is possible you could be pregnant. If you suspect you could be pregnant, don't insert a new ring and consult your doctor. So what are the main side effects of NuvaRing? So they are vaginal discharge of infections, headache, feeling sick, abdominal pain, breast pain or tenderness, slight bleeding or spotting between periods in the first few months, lighter periods or sometimes stopping of periods, mood changes. However, there's no evidence that the ring causes depression. Other possible side effects include cystitis or urinary tract infections, inflammation of the cervix, vaginal burning sensation, pain, discomfort, dryness or odour, fluid retention. However, there's no evidence that the ring causes weight gain. Also change in sex drive, rise in blood pressure, skin reactions, increased risk of getting a blood clot in an artery, which could cause a stroke or a heart attack, and increased risk of getting a blood clot in the vein, such as deep vein thrombosis or pulmonary embolism. So the risk of blood clots is also increased if you're travelling for periods of time where you will be sat still, particularly flights over 3 hours. So ask your doctor or pharmacist for advice on using travel stockings and for calf exercises or aspirin. Stop using NuvaRing and see a doctor immediately if you get symptoms of a blood clot, such as stabbing pains or unusual swelling in one leg, pain on breathing or coughing, coughing up blood, sudden breathlessness, sudden severe chest pain, migraine or severe headache, sudden disturbance in vision, hearing or speech, sudden weakness or numbness on one side of the body, or you may collapse. So what if you get pregnant while using NuvaRing? NuvaRing hasn't been around for as long as other contraceptive pills, but there is no evidence to suggest that it would be harmful to a baby either. The NuvaRing should not be inserted if you are or think you could be pregnant. If you do fall pregnant, remove the ring and get advice from your doctor. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.